Good afternoon, everybody. My name is Haley Yates. I'm the Manager of Strategic Solutions here at UBA, and on behalf of United Benefit Advisors and Foundational Pharmacy Strategies, I welcome you to today's presentation in the UBA Employee Benefit Webinar Series. Today's topic is the new world of fiduciary responsibilities in the pharmacy benefit, and our presenters today are co-founders Christine and Kelly. And with that, I'll hand it over to both you guys, and the floor is yours for the next 45 minutes.
Awesome. Thank you, Haley. We're honored to be here, and we're honored to be a Platinum UBA Alliance, and the work that UBA is doing, and we're just is great in the supporting of the agencies. We're very similarly aligned, and I'll just give you a quick background on us, but we we were founded to be able to support agencies with their pharmacy benefits that they support to their clients. So we only work with benefit agencies and provide that expertise that a lot of their employer clients are needing. So I'm Christine Johnston. I'm co-founder of Foundational Pharmacy Strategies. And then I've got Kelly Primich. Kelly, you want to say hi?
Hi, everyone. Thank you so much for having me today. I will be mostly in the background as I'm a pharmacist, and today's responsibilities are in fiduciary. So I'll be running some color commentary, but just wanted to let you all know that I'm part of the team and I'm the clinical support behind the scenes.
Thank you. So really, this is an educational session, and there's been a lot of talk about fiduciary, what's a fiduciary, what's not a fiduciary. And there's a lot of PBMs or pharmacy benefit managers out there that are claiming to be fiduciary pharmacy benefit managers. But fortunately, they can't be. And so let's revisit what is a fiduciary. The primary responsibility of a fiduciary is to run the plan at the sole interest of the participants and the beneficiaries, and for exclusive purpose of providing benefits and paying plan expenses. So a fiduciary must make sure that they avoid a conflict of interest, and if they don't follow these principles, they will be found personally liable. So that's a really important part. A lot of these people are named in some of the lawsuits that we're going to talk about today, but the fact that you can't hide behind your company, that the specific individuals are the ones who are automatically found responsible. And so it's really important that plan sponsors, employee benefit managers, that they make sure that they stay clear of any conflicts of interest, but that also trickles down into the relationships that they have. And we're going to talk a lot about that today. But the key takeaway here is that acting as a fiduciary doesn't mean that you have to have the cheapest option. But when you evaluate options, you need to do it in an unbiased manner and act in the best interest of the plan and its members. And it's also extremely important, and we're going to say this over and over again today, document the reason for a decision. So I sit in a lot of conversations, especially when we do a pharmacy benefit manager RFP, where we have really good reasons on why maybe we selected the 4th or the 5th PBM. Maybe it had to do with member disruption, or we didn't want to have people have to change their pharmacy. There's really good reasons, but the key here is to document why those reasons were done, so that if there's ever a question, you can explain it. And that's the key here. So, explaining fiduciary responsibilities, and the plan sponsors are ultimately the fiduciaries. And I really view this as an empowering statement. I think a lot of times when people think of fiduciaries, that comes with a lot of responsibility, compliance, burden, and a lot of negative things. But what it puts you in is it puts you in the control. You're the one that makes the decisions. You're the one that hold the purse strings. You're the one acting in the best interest of the employees and the participants. And I think that's often lost in our industry, where a lot of people think, well, it's pharmacy benefit managers that are in control, or it's the drug manufacturers that are in control. The bottom line is whoever pays the bills is in control. So it's a big responsibility, but when taken in a positive manner, really making sure that you're truly the advocate for your employees is what's really important. Now, benefit brokers and PBMs are delegated responsibilities by the fiduciaries, and I've seen some some benefit brokers recently starting to take on fiduciary responsibilities. I've seen some PBMs. I love the fact that they're wanting to be accountable and held accountable for that, but it still does not erode your responsibility at the plan sponsor level to be the responsibility. Now, if you do delegate those responsibilities, certain functions or whatever, make sure that you document what's being delegated and how you're going to oversee that, because ultimately you're going to be the one that is asked about their performance. So, there's a lot of lawsuits out there, and many of you have probably heard of these, and some of them have been dismissed, but they are in the process of being refiled. So I just want to talk about what impact we think. So the first one that really got the industry concerned was Johnson & Johnson lawsuit. And a lot of these lawsuits look very similar, almost the exact same trend, but it was really got people concerned that all of a sudden, people were thinking that ERISA is going to start holding people accountable for their fiduciary responsibilities, but in our world, it ends up being lawsuits, right? So there's lawyers out there that are looking for disgruntled employees that are willing to file lawsuits against their employer, claiming that they didn't act in the best interest. And I strongly believe that most employers do try to act in their best interests. But the bottom line is, and we'll talk about this a little bit, is that the industry is really stacked against them. And you need to make sure you have trusted advisors that you can trust to make sure that you're leaning on for support in administering your benefit plan. So in this case, Anne, who was an employee at J&J, sued her company for overpaying as pharmacy benefit manager. That recently is because, they weren't able to utilize, the J&J was not able to use Mark Cuban cost plus drugs, and the same drugs could have been purchased cheaper through Mark Cuban. And so it really, opened doors for large self-insured employers to face legal action. But this has since been dismissed because they said she wasn't damaged by this. Now they're taking another look at this, and it's probably going to get refiled. But in the meantime, though, it really does open up, like, how should you be looking at the benefit? What is defined as being prudent steward of the company's health plan assets? The next one, almost identical, almost the same entities involved. And I think, just like the Johnson & Johnson, 3 officers were named from the Human Resources Department specifically in this lawsuit. They're the ones that are being held accountable. This one has also been dismissed because of standing. They said that the individuals were not financially impacted by this, but it is also being refiled with much more specific language. But basically, that the Wells Fargo failed to satisfy their fiduciary obligations administering the pharmacy benefit. And so basically, there's a claim here that they paid the pharmacy benefit manager too much. And a lot of times employers think about, well, we didn't know that Express Scripts was retaining that kind of fee. Not knowing is not an excuse. You have to ask the questions, and you have to document that you asked those questions, and you have to document the answers to that. Not knowing just will not get you off the hook. So when we talk about the PBM industry and what can employers do about it, right? Like, unfortunately, the PBM industry is stacked against the employer. And so one of the things that Kelly and I spent a ton of time on, and that is managing specialty drugs. So as many of you know, that specialty drugs are 1% to 2% of the population, but control about 50% of the cost. And a lot of times people just automatically default to thinking that, well, it's driven by innovation, right? There's a bunch of new drugs out there. They're curing diseases that have never been cured before. And so it's being driven by cost. And I would argue that's part of it, but that's a very small part of it, because if you look at the number of new drugs that are released every year, it's very small. It really, in my opinion, and I got to be honest, I've been in the industry for about 30 years, so I'm a bit cynical when it comes to this stuff, but it really is driven by profit margin. So if you think about where are the profits going, you can see the trend over time here. So in 2012, 16% of a PBM's revenue on average was coming from their specialty pharmacy. So the specialty pharmacy usually in the big three PBMs, which are CVS, Optum, and Express Scripts, they own their own specialty pharmacy. They purchase the drugs either from the manufacturers or the wholesalers. They get rebates on those drugs, and then they sell them to employers. And so the 16% represents the amount that they retain from where they purchased it from the wholesaler or the manufacturer to when they sold it to the employer. Now that amount is 16%, and now it's up to what this is expected in 2023. So I haven't seen an updated report, but 39% of a PBM's revenue is now driven by specialty drugs. Now that same PBM is also the one that's managing the formulary. So they're deciding which drugs are covered. They decide how those drugs are covered, whether they have a prior authorization or not. And then if it does have a prior authorization, they decide how it is approved. So there's not a lot of financial incentive to not approve a drug through the prior authorization process. In addition, they're getting rebates, and rebates are driven by the percentage of the cost. So when you think about rebates, there's an incentive there to dispense the highest costing drugs because they're able to retain a portion of that rebate. So this is all, just kind of driving the increase in cost. And I think it's also just misleading here on this is that 16% of a much smaller pie. So if you also lay on top the cost of the pharmacies, expenses through time, that 39% is a larger piece, but it also is a bigger pie. So this is a significant amount of money that we're speaking of. And that's why you see a lot of specialty pharmacies being purchased by the big three PBMs, because they want to control that market share even more. Now, when we think about how does this relate to fiduciary responsibility? And I think from my perspective is employers need to start expecting more from their PBM. Knowing where the problems are, where the revenue is coming from, helps you have a more effective conversation with your PBM. Questions like, what was our PA approval rate on specialty drugs? Are you requiring documentation that the patient actually has a diagnosis? So a lot of times when people talk about fiduciary responsibilities, they're focusing on audits or RFPs, and those are important, don't get me wrong. But I think the most important thing is, what is your PBM doing on a day-to-day basis to make sure they're being a prudent steward of your benefit? And I don't want PBMs inappropriately denying when a patient needs it, but there are only a certain amount of resources that an employee benefit has. And they need to make sure that those resources are going to the right place. Kelly, I know you spend a lot of time in specialty. You got anything else to add on this topic?
I think it's interesting because in response to our fiduciary responsibilities, I've seen a little bit of a trend in people asking for conflicts of interest. And so I think it's important, again, to understand that it's not about dotting the I's or crossing the T's, but to stop and think, if you're in a group who gets a conflict of interest from your vendors, does it make sense? I think what we started to see, is a rebate aggregator became a GPO. And 2 out of the 3 big 3 moved it offshore. Why? So when they get conflict of interest statements, they don't have to disclose a different entity. And so I think, it's about a little bit of common sense where sometimes people think they're doing the right thing by auditing, by asking for those conflict of interest statements. But if we don't take a step back and say, well, how are we going to use this information to make a decision? Or are we objectively thinking about how they responded? If you get a big 3 PBM conflict of interest statement back and they don't disclose things that you expected, I think that's another reason that you should raise a red flag and definitely document what's not there. And so if anybody ever has questions on that, we've got a whole nother slide that talks about the vertical integrations. But that often is a question that I get from the market is, well, I asked for a conflict of interest and they didn't say anything about owning their own specialty pharmacy, or they didn't say anything about retaining a piece of the rebate. And even some of the mid-market PBMs, if they outsource their prior authorization to another company and they say, well, we can't report on it, we're not the ones, we've delegated that service. These are all the types of things you want to think about.
Yeah, thank you, Kelly, for leading into our next very important slide. And we love watching drug channels. So if you all are a pharmacy benefit nerd like us, make sure you follow the Drug Channels blog. But Adam Fine released the latest vertical integration relationship, and he had to actually reformat the chart this year because it got so complicated. There were so many different entities. But this is a big part of what Kelly's speaking of is that, the vertical integration that we have, and a lot of big carriers out there buy up pharmacy benefit managers or pharmacy benefit manager resources like specialty pharmacies in an effort because that's where they can make a lot of money. And the margins on the medical side are dwindling, and they can cover up that margin on the pharmacy benefit side. So you see, I'll give you an example. We've got CVS Health here in the middle, and they're associated with Aetna. And they also have a PBM called CVS Caremark. But then they have a rebate group purchasing organization called Zinc that is also Carolyn works with. And Zinc is a separate entity from CVS Health. So CVS Health is the holding company of all these different companies. But CVS Caremark, which is the PBM here on the second row here, they contract with Zinc for their services. They contract with CVS Specialty Pharmacy to distribute the drugs. They contract with CVS Pharmacies Network. So when CVS PBM says that we're passing through everything that we receive, that's true. But they're not passing through everything that their whole entire entity of CVS Health receives. And so as Kelly's talking about the conflicts of interest, those statements are only going to refer to the CVS Caremark portion and not Zinc's and not CVS Specialty, not Omnicare. So all of those are channels in which they can handle or hide little pieces of revenue. And that 39% on the previous slide is representing CVS's Health's percentage. And so a lot of us in the industry, myself, the National Alliance is another area where we're calling for end-to-end transparency. And what that means is making sure that CVS Health as an organization discloses where their sources of revenue are. And that's really important as you all being a fiduciary to understand that, because where their sources of revenue are is really a key indicator of where their recommendations are going to be. So if they're making a recommendation to adopt or recommend a specific specialty pharmacy solution, you want to make sure that you understand, is that in my best interest or is in the PBM's holding company's best interest? And those are the questions that as a plan sponsor, you need to ask. And I firmly believe that if more employers in this country start asking those hard questions, we're going to have a lot more accountability in our industry. And we don't want to rely on the government to make these decisions for us because they might not be the decisions we made. But by asking these questions as a fiduciary and documenting those things, you're going to better understand why your costs may be going up and what you can do about it. So the FTC also, caught on to this too. And this was the last administration, but we have seen a lot of movement continuing on into this administration with the work that the previous FTC leadership did. And really, there's a very great article that you should go out and read. We have the hyperlink here, but talking about how the vertical integration is not only affecting affordability of drugs, but it's also affecting accessibility. And one of the big areas that I think is important, and we as an industry have focused on getting deeper discounts at pharmacies. And by doing that, what has happened is that independent pharmacies, which many of you might be in a rural community, those are very important healthcare hubs. The pharmacist is often a trusted clinician that the local community can go to. I know my mother-in-law lives in a rural community, and it's a very important resource to her. She'll pop into the pharmacy and ask the pharmacist a question on a regular basis. If that pharmacist wasn't there, though, because they couldn't afford to stay open, that's important. So an idea that I kind of had is making sure that you're not just trying to achieve the best discount, right? That's important. We want to manage costs. But by doing that, is that going to impact your employees' access to care? And this is a really important thing that we're seeing. And the other thing is specialty medication monopolies. We're starting to see, because the drug manufacturers have what's called limited distribution on drugs, they will only allow certain pharmacies to dispense that, which again, you know, the basics of economics, when you have less supply, you can raise the cost, and because demand is what it is, and you can raise the cost. And so there's a lot of things going on because of that vertical integration. It's not only hurting the employee benefit plan, but it also is hurting our local communities.
Hey, Christine.
Yeah.
It looks like somebody raised their hand, so I'm going to try and allow them to talk. Timothy, I'm going to click the allow talk button and hopefully you're able to chat. So I'm going to give it a try. I think you just have to unmute yourself and you should be able to ask your question or give your comment if you are there and you meant to raise your hand.
He put his hand down. Okay.
Well, if you have a question, feel free to type it into the Q&A box as well. That is also available for everyone else here as well. So sorry to interrupt you, Christine.
Thank you. Okay. So what are our recommendations? And Kelly and many of those who work with me on a regular basis, I like to keep it simple. Usually nothing more than 3 things, because I can count to 3 very easily and I can remember those. So our recommendations are partner, manage, and monitor. Pretty simple, pretty basic principles. But sometimes because, and we see it all the time, but because employers just feel really overwhelmed by some of the barriers they have that we talked about previously, it's really, sometimes they think that they don't have these options. So let's talk about partnership. And partnerships, making sure that your partners that you have, your benefit advisors, your pharmacy benefit managers, your medical carriers, the people that you work with within your benefit team, you have aligned incentives, right? You're all working from the same, as we say, you're preaching from the same hymn book, right? So you say, making sure that everybody has the same goals, and that financially, the compensation is such that there isn't a motivation one way or another to make a recommendation. For example, Kelly and I, we make the same fee regardless of which PBM we recommend, or regardless if they even go out to bid. So our services are driven by what is in the best interest for the employee benefit plan. Understanding the sources of revenue. So if you're with a particular PBM, what percentage of the revenue is coming from their specialty pharmacy? Do they own that specialty pharmacy? Is it part of another entity? Understanding that. But I think it's really also important, and I know we have a lot of benefit advisors on the phone, but asking for the employers on the phone, asking your benefit broker or advisor what their sources of revenue are, because this is something that really hasn't been talked about a lot. But the incentives that some of the big agencies have to place business with the big 3 PBMs is a reality. And I know, because I've been there, that their recommendations are actually made because of how much revenue they make. And that's an important thing for you to know, and is not often disclosed. And one of the things that kind of is for Kelly and I, when we go in, and if we get a PBM that says, well, we can do that, but we're not going to. I was literally on an implementation call last week and said, well, we functionally can do that, but we're not going to do that. And I was like, okay, wait a second, because the plan wants it that way. And you have to wonder, is it an operational issue or is it a financial issue? It's one of the two. And if it's a financial issue, I think that's really important to understand. And, people don't try to have complicated benefits because they want to keep it simple for their employees. So if they're not willing to do something, you need to ask, and is that a partner that you want? Kelly, do you have anything to add to this? Okay. Manage. So again, setting a focus, right? Setting a strategy. So a lot of times people just go in and say, I offer an employee benefit plan. Okay. Well, what are you trying to do with that plan? Are you trying to retain employees? Are you trying to just meet the basic minimum requirements that you have to have because of a regulatory requirement? What is your purpose And therefore, how are you going to manage it? Because if you're really wanting a low cost benefit, but you have an open formulary, you let anybody get whatever, that's counterintuitive. But if you also want to retain employees, what drugs are you covering? And is it appropriate? And so helping you set a strategy and what are going to be areas of focus and understanding what needs to feed that. And then making sure that your advisor is providing recommendations to make sure that you're meeting that strategy. So then as you go throughout the year, you're always looking at what are some things that you can do to go toward that strategy and not to get distracted by the things that don't help accomplish that. And then monitor. I know, like, I'm pretty bad at this. I would always set with my kids a chore goal chart, right? And the first week it was great. They put the stickers where they need to go. And then the second week it was like, sometimes I'd remind them to do it, sometimes I didn't. And then guess what? Their behavior changed, as we stopped monitoring how they were achieving those chores or those goals, the performance dropped. So one of the things that's really critical to the success of your benefit plan is monitoring and measuring the effectiveness of the strategy you decided to implement. And if something's not working, stop doing it, right? But the key here is document, document, document. So whether it's having a quarterly review with your PBM or a quarterly review with your benefit advisor, document that, make sure that those reports are measuring towards your goals and that you're having a conversation about how the plan is performing compared to the goals that were set. So just to kind of roll it all together, really, what can you do? We think establishing a fiduciary committee, that might be 3 people, right? It might be the CFO, it might be the benefit manager, maybe the employee benefit or the human resource manager. And then maybe your benefit advisor is a supplement to that to help support the committee. But here, meeting on a regular basis and making sure you have an agenda and making sure that your strategy regarding the employee benefit plan is always up front. Create a document repository. This is where you would save all the reports you get from your pharmacy benefit manager that you're monitoring their performance or any rebates or anything like that, or any notes from your fiduciary committee to make sure that you're documenting the activities. How many of us document what we do every day in email? I mean, that is very common, right? But what if you just saved that email that was an important decision as to why you made that decision, and you just saved it as a PDF in this folder? Therefore, if anybody ever questioned why that decision was made, you have it right there, and you're not opening yourself up to any liability. This is my compliance manager hat going on here. I love this next one because of that. I used to do a lot of compliance auditing, and it is creating a defined process to monitor the provider's performance and their financial incentives. So understanding how they're performing against the goals, and then also understanding how is their financial interest aligned. Okay, so yes, you're working with CVS. So you're working with CVS Caremark, they're owned by CVS Health, and understanding the channels in which those financial revenues go through. Okay, you're with Aon, and understanding, the various different sources of their revenue, I think is really important, and you get that updated every single year. The importance here is knowing, and we talked about that earlier. Not knowing is not an excuse. And then perform a PBM evaluation that consider all the aspects of a PBM arrangement, not just discounts and rebates. For any of you that know me, this is where I live and breathe every day. And a lot of times people are like, well, I just have to ask for the best rebate and I just have to ask for the best discount. Unfortunately, those discounts and guarantees and those rebate guarantees have really driven some of this bad behavior. That's because our industry is asking for it, therefore the PBMs are delivering. And if we start holding the PBMs accountable to actually manage costs, which is indicated by the last word of their name, management, making sure that they're actually controlling cost and making sure that their trend rates are reasonable, which we've been seeing some crazy turn rates as of late, that is not an unfair expectation. They are a pharmacy benefit manager with a capital M, and we want to make sure that we hold them accountable. Yeah, you can get a great discount and you get great rebates. And I used to work at the Teamsters, and they said, "Hey, Christine, I think the only way I can get a good rebate is if my costs are high." And this guy drove a truck for a living and pretty smart. One of the smartest things that people have said to me, and he's right. So lastly, just in conclusion, just to wrap it up, and then we'll open up to any questions that anybody might have. But employers need to demonstrate they're managing their pharmacy costs, and we talked about some recommendations related to that. Employers need to make sure that they have a broker or advisor that's not conflicted. And I know within the UBA, there's a lot of those. I talk to them on a regular basis, and they're just wanting to do the right thing for their clients. And employers need to start looking beyond the big three for their PBM solutions, because the big three, they're financially motivated. Their incentives are not aligned with an employer. And unfortunately, there's little transparency. So not knowing is not an excuse, as we've talked about. And it's going to be hard for you to understand their financial incentives just because of the way they're structured. So with that, I will turn it over to see if there's any questions.
So Christine, I'm not seeing any questions. I'll let Haley do a double check here, but as we wait for people to go ahead and type in any questions you may have, I jotted down 3 things that I am frequently asked on this topic. The first is, why aren't there more lawsuits? You talked about Wells Fargo and J&J, and I know JP Morgan popped up for a minute before it kind of faded away. And my explanation to people is, what you see in the news is the tip of the iceberg, right? So going back to, people have used an iceberg example for years. What we are seeing is that a lot of these cases are moving to private arbitration. So it's not that this is, a non-issue, or, there's only been 2 or 3 high-profile cases. Do I need to worry about it? But what the vendors learned from those first couple cases is that if they go and pursue this in an open court of law, those documents are available. And to Christine's point, people then can copy them. And so as the judge says, you need to be more specific here, or, we need to understand the impact to the individual who brought forward the case, each one that follows can get a little bit smarter, a little bit more pointed. And so we saw a shift to private arbitration because the records can be sealed. And so that helps from a PR perspective, and that helps from a prevention of, the Aon, the big three, seeing subsequent cases as, news gets out that this buzzworthy case, settled in a certain direction or another. So that's a frequently asked question I get a lot is, why aren't there more? I think there are more, but I think you got to look at the private arbitrations to see where those are going. A second question that I'm asked a lot about is what you talked about with the monitoring. I have had, I think GLP-1s is no surprise to most people on the call. People will reach out and say, hey, what vendors are out there? And it's shocking to me that when we sit down, so many people have third-party point solutions in place to help with diabetes or polypharmacy or other stuff. And honestly, the client didn't even remember that they were there. There was so few engagement. And so again, going back to the basics of, did the plan take an action? Was it monitored to see if people were engaging and how it was performing? It's a step that I just want to emphasize not to overlook, because you may uncover some information that, you would think the plan would be, very well aware of, that honestly, they just have so much on their plate, or the HR team turned over, or, the agency switch, that people can forget sometimes what they have in place. Or they might have duplicate programs in place. So, don't overlook that monitoring. And then the last thing, because I still haven't seen any questions, so make sure you pop them in there if you haven't already. But that document repository. Sometimes we get questions, and Christine, I might defer to you on this one, but similar to people, whether it's a PBM or a certain agency going out with this marketing buzz and saying, hey, we'll be a fiduciary PBM, or we'll take on the fiduciary responsibility as an agency as a way to kind of get in for sales. we've started to see document repositories coming forth as a market solution. And Christine, do you want to talk about kind of some of the things to look out for if your client is considering adopting one?
Think it's really important to make sure that the document repository is housed within the employee benefits organization. Now, and it's managed by the employer as opposed to having a third party doing that, because then if you terminate that contract with that third party, then it goes away. All that work that you did disappears. And they could also start saying, oh, you can't use that if you want to go evaluate a PBM solution because it's our data. And so where it's housed matters. And the key here is that when you pay the bills, it's your data, in my opinion. And anybody who tells you otherwise, just give me a call. I'll help you out. But if you pay the bills, it's your data. And data is power in this industry. And that's why you want to make sure as much of it is housed within your four walls as possible. So I don't see any questions, Haley, but I know that my contact information is at the beginning of this presentation. I love talking about this topic, maybe a lot more than you guys want to talk about, but feel free to reach out to me if you all have any follow-up questions. Happy to have a dialogue. We're all about making sure that we help the industry understand these important topics. And so even if you're not a client of ours or anticipate being a client, we'd love to have the dialogue, just to get the word out. So I'm going to turn it to the last slide, Haley.
There is a Q&A actually that just popped in.
Oh.
And I can read it. Kelly, you might be able to decipher it a little better than I'm going to say it out loud. But the question is there a PBM not tied to one of the big three? In parentheses, systems, mail order, specialty, rebate, GPO, question mark. Example, Magellan RX private labeled Optum RX / Elevance private label CVS / ESI.
Kelly and I, one of the things we do, it's become a hobby of ours, is we do PBM evaluations. And UBA agencies have the benefit of the expertise that we've garnered from those evaluations. But there are a lot of PBMs out there. There's, I think, 75 different PBMs. And one of the things that Kelly and I look at when we evaluate these PBMs is, do they own their own GPO? Do they contract with a GPO? Do they own their own pharmacy? And there's really there's PBMs out there really trying to do a great job of staying independent. It's difficult though for them to be financially competitive, but honestly, what we found is that if you try to be competitive on discounts and rebates, maybe it's not there. But if you start doing things like trying to be competitive on actually managing costs, like having a formulary that controls costs and not drive to rebates, or taking advantage of some copay assistance or other innovative programs out there, or some unique clinical strategies, they actually financially, when you look at everything, they are very competitive financially. I don't want to call out specific ones, but there are a lot. I got to tell you, I was really happy because I came out of a pass-through PBM that I ran for a bit, and I was really pleased that there's a lot of good ones out there that are trying to do the right thing. And if you want any specific advice, let me know. But we found, I think, about 10 that we would say are really solid, good, trying to do the right thing and financially aligned.
One thing that's interesting is some of those mid-market PBMs, they came out of pharmacist generation families that own their own stores, and they got frustrated and they created their own PBMs to address some of the issues they felt as an independent pharmacy chain in their community. And so it's one of those things where, you may look at it and say, oh, this PBM, owns its own pharmacies or is somehow affiliated with it. But is that the same as maybe the big three? And so those are the types of evaluations when Christine and I have sat down with them for hours that we're asking, how are you set up? Are there potential conflicts of interest? And so there's 8 operational areas that we really focus on. So to Christine's point, given the volume of PBMs we've spoken to date and all of their uniqueness, and kind of peeling back that onion to get even deeper to say, okay, you own your own pharmacy or you're leveraging a different system or contract. What does that mean to you? And how does that play out from a conflict of interest perspective, or does it not? And making sure that you have that documentation on file is really critical.
And we are almost 50% through the industry. We have evaluated of the 75, 30. So we love to talk to any PBM. So just let us know.
Christine, how many point solutions are we up to?
200.
Mm-hmm. And I think that's really important too, because as we're seeing strategic partnerships through the carriers, through the PBMs, someone will be like, what's the difference between Vita and Virta and 9AM Health? And so, you know, it's one of those things when we talk about pharmacy that it's not just the PBM, but we're looking at the pharmacy benefit manager, the carrier, all of the point solutions to make sure that, you know, we're laying it all out on the table and we can assess and decide based on the facts and the data and the culture, what's the best fit.
To be precise. So, we love what we do. So, okay, I think we're ready to wrap up, but if you all have any questions, my contact information is earlier. I am very active on LinkedIn. Feel free to reach out to me on LinkedIn also.
Awesome. Well, thank you so much, Christine and Kelly, for your thought leadership and sharing your expertise. And thank you to all of our UBA partner firm employees and any of their clients who joined us today for our webinar series. Our next webinar will be May 20th, and we look forward to you joining us next month.
Thank you.